Hello and welcome. In today's video, we're going to walk through the essential steps of selecting an ICD-10-CM diagnostic code. Whether you're a new student or someone looking to refine your skills, this video will break down the process into easy-to-follow steps and give you details often missed or overlooked. So let's get started. The first step is to thoroughly review the medical documentation. Accurate coding relies on complete and specific documentation. For inpatients, this may include the face sheet, discharge summary, and operative reports. For outpatients, you'll refer to encounter forms, test results, and final notes. Remember, always ensure that the information is accurate. If there's conflicting information, such as in the case of different diagnoses on the face sheet and discharge summary, you'll need to query the provider for clarification. Next, familiarize yourself with ICD-10-CM coding conventions. These conventions, like instructional notes and cross-references, are critical for ensuring that the correct code is selected. Remember, you always need to use both the alphabetical index and the tabular list. The alphabetical index will guide you to the code, but the tabular list will help you confirm that the code is accurate and at the highest level of specificity. Now let's walk through the specific steps of diagnostic code selection. Step 1 is to locate the main term in the alphabetical index. The main term refers to the condition that is present. For example, in the diagnosis acute allergic sinusitis, the main term is sinusitis. Step 2 is to check the main term entry for any instructional notations. These notes will tell you if you need to consider other factors like laterality or severity. Step 3 is to identify any modifiers to the main term. Modifying terms like acute, chronic, or bilateral will refine your code selection. Step 4 involves following any cross-reference notes found in the alphabetical index. Sometimes, the main term entry will direct you to look elsewhere for more detailed codes. Step 5 is to verify the code in the tabular list. Do not skip this. The tabular list will help confirm if your code matches the diagnosis and if additional characters are needed. Step 6 involves following any instructional notes you see in the tabular list. These notes provide guidance on whether additional codes are needed, like for associated conditions or complications. In medical coding, particularly with ICD-10-CM, initial, subsequent, and sequela refer to different stages of a patient's treatment and care during encounters for injuries or conditions. These terms help clarify the stage of care being provided and ensure accurate coding for proper documentation and billing. Here's what each term means. Initial encounter, A. This is used when the patient is receiving active treatment for the injury or condition. Examples of active treatment include surgical procedures, emergency care, or initial evaluation by a healthcare provider. We look at the acute phase of treatment. This refers to the period when a condition or injury is new, sudden, and severe, and the focus is on addressing the immediate symptoms and managing the critical aspects of the illness or injury. This is often when the patient first seeks care, and healthcare providers focus on stabilizing the patient, relieving pain, and treating the primary issue. In the context of medical coding, this phase includes active treatments such as emergency interventions, surgery or procedures to repair or stabilize injuries, initial assessments and diagnosis, prescription of medications to control symptoms or reduce severity, and other immediate therapies aimed at curing or significantly improving the condition. The acute phase is characterized by the body's initial response to the injury or illness, which can include inflammation, pain, and other sudden or intense symptoms. Once this phase is resolved or managed, the patient moves into subsequent care or a recovery phase, which is a subsequent encounter. A subsequent encounter, D code in medical coding, is used to document patient visits after the initial or acute phase of treatment has been completed. These encounters occur when the patient is no longer receiving active, emergency, or critical intervention, but is now undergoing routine care, follow-up, or monitoring as part of the recovery process. The main focus in this phase is to support healing, ensure that recovery is progressing as expected, and address any ongoing issues related to the initial condition or injury. Subsequent encounters reflect ongoing care that is essential for full recovery, but is no longer part of the critical, active treatment stage. These encounters are focused on ensuring that the patient returns to full health, or as close to it as possible, and prevents future issues related to the initial condition. Then there is sequela, S. In medical coding, this refers to the residual effects or complications that persist or arise after the acute phase of an illness or injury has passed. These effects are often long-term or develop well after the initial condition has resolved, and they directly result from that previous condition. In ICD-10-CM coding, the sequela code documents the lasting damage or complication rather than the original injury or illness itself. These late effects are usually chronic or permanent and can vary widely depending on the nature of the initial condition and the patient's healing process. A sequela is a late effect. Sequela refers to conditions or complications that appear after the acute phase is over, sometimes months or even years later. The original injury or illness is no longer being actively treated, but its effects persist. The condition coded as sequela must have a clear causal relationship with a prior condition. For instance, if a patient suffers from a stroke and later develops hemiplegia, paralysis on one side of the body, the hemiplegia is the sequela of the stroke. Sequela conditions are chronic in nature, are often long-lasting or permanent, requiring ongoing management or care. In most cases, when coding a sequela, you must use two codes. For example, for chronic pain resulting from an old fracture, you would code the chronic pain and then the sequela code for the fracture. The first code describes the residual condition or complication, being arthritis. The second code references the original cause of the sequela, an old fracture. Common examples of sequela could be things like chronic pain. If a patient experiences long-term pain after an injury, like a fracture or soft tissue injury, this pain is considered a sequela. Arthritis can develop years after a joint injury or fracture and is often coded as a sequela of that injury. Scarring from a burn or surgical procedure would be coded as a sequela of the burn or surgery. Paralysis after stroke or other neurological deficits that persist long after the acute treatment for a stroke are sequelae of that stroke. If PTSD develops as a result of a traumatic injury or event, it can be coded as a sequela of that specific event. A good rule of thumb. When coding a sequela, always code the sequela first, the chronic condition, like arthritis or pain, and the original condition or cause second, such as a healed fracture. There is no specific time limit for sequela to develop. It can be coded at any time if the residual condition is clearly linked to the prior illness or injury. Example of sequela coding. If a patient develops arthritis in their knee due to an old fracture, you would use two codes, arthritis code, to represent the current chronic condition, arthritis, fracture sequela code, to reference the old knee fracture that caused the arthritis. Sequela coding focuses on documenting the ongoing, long-term effects of a previous injury or illness, ensuring that the long-term consequences of medical conditions are accurately tracked and managed. So what is the difference between the subsequent and sequela? Many people do not understand the difference between the two. Sequela and subsequent encounters refer to different stages and aspects of a patient's care, and they are used in medical coding to indicate different types of encounters. Here's how they differ. First, look at timing and nature of the condition. For a sequela, you refer to late effects or conditions that arise after the initial illness or injury has healed or is no longer actively being treated. These effects can occur months or years later and are chronic or long-term. For example, arthritis developing after a bone fracture, chronic pain after an injury, paralysis after a stroke. The original condition has resolved, but it has left behind a residual, long-lasting effect. For a subsequent encounter, you refer to follow-up care during the recovery phase or healing process after the initial injury or illness. These encounters occur soon after the acute phase, while the condition is still being actively managed, such as during rehabilitation, wound care, or physical therapy. Examples: follow-up visits after surgery, regular wound care after a burn, physical therapy after a fracture. The condition is still healing, and the patient is receiving ongoing treatment or care to promote recovery. Then look at the stage of care for sequela. The patient is no longer receiving active treatment for the original condition. The focus is on managing the chronic or residual effects of the previous injury or illness. Care is aimed at addressing long-term issues that result from the original condition, not the condition itself. For example, a patient had a fracture 2 years ago, and now they experience chronic arthritis in that area. The arthritis is the sequela of the healed fracture. The fracture is no longer being treated, but its effects, arthritis, are managed. When coding a sequela, this usually requires dual coding. One code for the current complication or condition, like arthritis, chronic pain. Another code to reference the original cause, like the old fracture or injury. This shows the long-term effects of the original injury or illness. For subsequent care, the patient is still receiving care related to the healing or recovery process. The focus is on ensuring the patient's injury or illness heals correctly or to prevent complications. It involves routine follow-up visits, therapy, or rehabilitation to restore function and promote full recovery. An example of subsequent care is if a patient had a fracture 2 months ago and is attending physical therapy to regain strength and mobility. The fracture is still healing, and the patient is in the recovery phase. So just remember that sequela focuses on long-term, chronic effects of a prior injury or illness, and subsequent focuses on ongoing treatment for a condition that is still healing but no longer in the acute phase. Finally, Step 7 is ensuring you are selecting the correct code based on all the information you've gathered. Always ensure that your code is at the highest level of specificity available. ICD-10-CM codes are highly granular, meaning they provide a lot of detail. Codes can specify the laterality of a condition, whether it affects the right or left side, or indicate the stage of care, such as an initial or subsequent encounter. For example, when coding a femoral fracture, you'll need to indicate not only the location of the fracture, but also the encounter type, whether it's an initial, subsequent, or sequela visit. Now, let's put what we've learned into practice. Take a moment to look at this diagnosis. Ulcerative esophagitis with bleeding. What's the main term here? Remember to ask yourself what the patient is actually coming in for, and which words are describing that term or giving more detail. The main term is esophagitis. Now, from here, you would follow the steps we've discussed to assign the appropriate code. Now we can use the steps we have learned to determine the ICD-10-CM code selection and bring this process to life with a real case scenario. Our patient, Mr. Johnson, is a 62-year-old male who presents with a closed fracture of the right femur after a fall at home. Your job as a coder is to select the correct ICD-10-CM code for this diagnosis. Step 1. Locate the main term in the alphabetical index. The main term for Mr. Johnson's diagnosis is fracture, since the condition is a broken bone. Step 2. Scan for instructional notations under the main term. For fractures, the notations often guide you to add more specificity, such as the location and the type of encounter. Step 3. Identify modifiers, or modifying terms. For Mr. Johnson, the modifiers are right and closed, which describe the type and location of the fracture. Step 4. Follow cross-reference notes in the alphabetical index. In this case, the index may direct you to a more specific category for fractures of the femur. Step 5. Verify the code in the tabular list. For Mr. Johnson's diagnosis, the code for a closed fracture of the right femur would be S72.91. But we're not done yet. Always ensure you check for additional characters required for laterality and encounter type. Step 6. Follow instructional notes in the tabular list. This involves reading and applying any instructional notes you find in the tabular list. In this case, we need to add a 7th character to indicate the type of encounter. Since this is Mr. Johnson's initial encounter, the 7th character would be A for initial encounter. Step 7. Select the final code. Hopefully you are at S7291 in the tabular section of your ICD-10-CM. Here you will select the full and correct code. Notice that the symbol beside the S7291 code, this means you need a 7th digit. You will get that 7th digit by looking under S72. These notes are for all S72 codes. If you notice, S72.91 is only 5 digits. There is no 6th digit, so an X will go in the place of that 6th digit. This is called a placeholder. It literally holds the place of missing digits. So in this case, the placeholder is needed for the 6th digit, so you can apply the 7th digit. The final ICD-10-CM code for Mr. Johnson's diagnosis is S72.91XA, closed fracture of the right femur, initial encounter. Wasn't that easy? The more you practice, the more you train your brain and your eyes. What to look for? In the beginning, we focus on accuracy, and with practice, you will increase your speed. By following these steps and thoroughly reviewing the documentation, you can now assign accurate ICD-10-CM diagnostic codes. Remember to practice. I hope you find this video helpful. Thanks for watching, and happy coding!